us today. Donna, if you're ready to get started, go right ahead.
Hello, my name is Donna War. I'm a registered nurse and an international board certified lactation consultant. Thank you for joining the webinar. I'm employed as a lactation consultant at Lee Health in Fort Myers, Florida. I have no other financial disclosures or no product endorsements. So today we'll be talking about the missing piece in bereavement care, which is lactation support. And to give you I've worked 30 years as a NICU nurse, which led me to become interested in infant nutrition. I became a lactation consultant and worked in both roles as a registered nurse in the NICU and a lactation consultant. And I soon realized that when a mother was pumping and had a large amount of milk supply, if there was a fetal demise, this mother had no lactation support whatsoever. So that I did write a journal article, which appeared in Neonatal Network, just to give NICU staff a little something to tell this mother or remind the mother to reach out for assistance. With this article, there was a handout that talked about how to suppress your milk supply, and that is included later on in my slides. And when I became a lactation consultant covering the mom-baby units, I quickly realized that this doesn't just apply to NICU. I was called to labor and delivery for a mom that it was her third baby, and it was a fetal demise at delivery. So she was already full with milk. The nurse had bound her breast, which is a old treatment, and we do know now binding the breast creates pressure on the breast, leading to milk trapping. So I had to re-educate the nurse with the latest techniques as well as the mother. I also recently had a mother that was giving her baby up for adoption, and she was fully engorged throughout. Fortunately, she was in the hospital and on antibiotics, so that prevented any mastitis from occurring. The nurses did not get her pumping because she was giving her baby up for adoption, not thinking that she was already producing milk. So she did have to pump and wean off her production. Also, mothers who are surrogate, they might do that many times, so they will quickly produce milk. With each pregnancy and each infant, milk production starts quicker, and milk comes in quicker. We have colostrum first for like with the first baby, like it starts to change to milk like maybe around day 3, and by day 5 they have milk. But with each pregnancy, this process occurs a little quicker. Also having a child removed by protective services, this mother could be also producing milk and need assistance as well. So my objectives in this webinar is to have information about safe lactation suppression strategies that can be provided to these mothers by the caregivers. Families will receive information on support and care services. They will also receive information on weaning or donation. So lactation suppression can be done safely with education and support. If breast milk production is not weaned and is done abruptly, this could lead to medical issues for the mother who was producing breast milk at the time of her baby's demise. Due to the psychological pain of an infant death, physical pain and lactation issues usually go unaddressed. The mother really doesn't think about it until she's uncomfortable, until there's discomfort of the breast and they're full and firm, and then she starts reaching out for assistance. So we do want to talk to this mom a little bit about stress. Stress is the body's response to challenges or demands. With stress comes high levels of cortisol that can inhibit oxytocin. Oxytocin is the hormone that controls the letdown reflex and free flow of milk. So stress can interfere with the milk production. However, stress and oxytocin kind of downregulate each other. And I put this reference here. It's from the Archives of Psychiatric Nursing, because this article talks about how oxytocin downregulates cortisol in patients with post-traumatic stress syndrome. So stress is not a predictor of stopping milk production. It initially slows it down, but it can pick up later on with spikes in oxytocin. Very interesting article. So in talking to these mothers about stress, some of the stress reduction techniques are, of course, maintaining a healthy, balanced diet. She will just feel better if she's eating properly. And a lot of times they neglect their nutrition during the time of a fetal demise. Deep breathing exercises, meditation, progressive muscle relaxation, relaxation with music, mental imagery relaxation, and of course, exercising with weight training, yoga, Tai Chi. Any aerobic exercises release endorphins. So these techniques will just help the mother feel a little bit better. So we'll a little bit about abrupt weaning, which is typically what these mothers do, because as I said before, they usually wait until the discomfort sets in. So if pumping is stopped when there is milk production, it could lead to engorgement. So it would first cause milk trapping, plugged ducts, engorgement, and then if it's not really resolved, it will lead to mastitis, which is a breast infection. The mother may require antibiotics for treatment, and I've even seen patients that required a drain be put into the breast with a really bad infection of mastitis. If the mother comes to us with plugged ducts, she can take lecithin, which is a emulsifier that disperses fats and oils. There is no side effects, so we can recommend that to her, but we have to catch her early so we can resolve the engorgement and make sure it doesn't lead to mastitis. So safe suppression can be done if the mother weans off pumping. So these are some pumping techniques that we usually go over with the mother. When the breasts are full, pump to comfort only. Emptying the breast completely will trigger milk production. So a typical pumping session is 15 minutes long. I've had mothers ask me, how long does it take to pump to comfort? So I usually tell them half a pumping session, about 7 minutes, and then they usually don't realize that the breasts are more comfortable until they take the pump off. So that's why they like a timeline. Massaging the breast before and during pumping will help relax the milk ducts. Also, when the mother is massaging, she can feel if there's any areas of milk trapping, and we recommend that she massage the area really well to help break up the milk that's trapped and kind of push it to the breast to help the nipple to help it come out. Increasing the time between pumping sessions will help the mother drop a pumping session. So typically, they would be pumping, if it was a NICU mom providing milk for her baby, typically they would be pumping 8 times a day. So if they're already on a pumping regime, they need to wean off that pumping schedule. So if it was a mother, like in the other situations, they would only be pumping to comfort. A mother that was pumping 8 or more times a day, would try to increase the time between her pumping sessions so she could drop a pumping session each day. So weaning off of pumping is the main strategy to safely suppressing supply. So comfort measures that we provide the mother with is sleeping supine or on her back, which helps drain the milk back so it's not accumulating in one area, because gravity will pull the milk to the side if the mother lays on the side. Also, laying on the side compresses the breast and can cause trapping. Any compression on the breast can cause the milk to trap. So supine sleeping is the best, using pillows to support the breast, wearing a well-fitting bra with breast pads. Again, the bra should be well-fitting. Most of the time, mothers need to buy a larger size than they were wearing pre-pregnancy. And no underwires. Again, anything that creates pressure on the breast can cause milk trapping. So underwires or a tight bra can lead to the trapping. Breast pads, because if the mother is around another baby or just out in public and hears another baby crying can elicit a letdown reflex. So we recommend that she wears breast pads until the weaning is done. Breast pads with no plastic. Plastic keeps the environment warm, moist. It's already a warm, dark environment, and keeping the moisture in with a plastic breast pad can lead to a yeast infection. So we don't want to have another infection while she's attempting to wean. We recommend applying cloth-covered ice packs to help bring down any swelling that might occur and constrict. Mothers love to use heat because it feels good, but heat brings more milk to the surface. So the only time with weaning that we do recommend heat is if she's so fully engorged that pumping is not relieving her breast. If the areola area is engorged, she may not be able to get any milk out while pumping. Heat can help at this time to soften. So washcloths moistened with warm water, hot water, wrap the breast in the moist heat and massage while the heat's on. 2 to 3 minutes only. Longer than that brings more milk to the surface. Pumping right after a hot shower is also a good time to pump because the hot shower is bringing more to the surface. Again, keeping it a half a pumping session just to comfort. Minimize breast stimulation. Use over-the-counter analgesics such as Motrin, and antihistamines are made to dry up secretions, so they will also help dry up the milk supply. Alternative comfort for self-care should be done with a licensed provider, such as acupuncture, massage, relaxation techniques, biofeedback, vitamin, and herbal therapies. Stress can compromise the immune system, so the mother may require additional vitamins. Again, this should be done with a licensed provider. Herbs that can interfere with milk production Some herbs can interfere with milk production. Other herbs will like induce milk production. So the herbs that interfere with milk production, strong peppermint can interfere with milk production, such as like even candy, such as Altoids. Um, Sage, spearmint, lemon balm, and teas and oils can decrease milk supply. Again, working with an herbalist that has more knowledge of exactly the dosing of the herbs that would help decrease the milk supply is preferable. Cabbage leaves are also recommended to use as a compress. And it is an old therapy that we used to recommend. I should say used to recommend. I don't typically recommend it any longer because our vegetables have a lot of pesticides that are used, and we really don't know where they're getting the cabbage from if they don't clean it properly. So they could be introducing bacteria to the breast and the pesticides. So even though we know that it does work, we kind of stay away from it. The chlorophyll does pull like the engorgement from the breast, the swelling from the breast. But I'm careful about recommending that therapy anymore. I just recommend the ice packs, which kind of does the same thing. Other considerations that we should keep in mind: a medical provider should be contacted with signs and symptoms of mastitis, which is flu-like signs and symptoms. Fever, chills, joint aches, red and sore areas that are warm to touch, tender, sore, aching breast. These are all signs of mastitis, and the mother will most likely need antibiotics at this point. Keep in mind that ovulation may occur during the suppression time, so birth control measures should be taken in consideration as well. So how long does suppression take? That's a question that everyone asks, and we really don't know the answer to that because every woman is different. It depends on the situation. It depends on how much milk she was producing, how strong are her letdowns, how many letdowns does she have. Some women have more. Some women have letdowns that are sprays when they're pumping, and they may have more than one. They can have 2 or 3 letdowns. So that's going to depend on how long it's going to take her to wean if she's expressing and leaking in between pumping sessions. And actually, how long was she pumping? Was the baby a couple days old or a couple months old? So that impacts her volume. Keeping nipple stimulation to a minimum because that will stimulate milk supply. Another pregnancy could interfere or stimulate milk supply. It could take days or months to completely resolve. I actually had a patient that after 2 years of breastfeeding, weaning her last child from breastfeeding, after 2 years of the wean, she was still having drops of milk come, but this was also her 4th baby. So these mothers do require a lot of emotional support. So the grief of a mother not being able to put her baby to breast is profound. At the time of the infant's death, symbolic acts of parental care should be allowed. Some mothers like to express some milk and put some drops on the baby's lips for the last time. They may even want to mimic putting the baby to breast. They may want to do some skin-to-skin holding. Allow the mother to decide what to do with her pumped milk. We usually suggest taking a container of the milk home for a memento. even if they leave the hospital without their milk, they typically do not come back to the hospital, even if they want it. Coming back to the hospital just brings all those memories back to them. So if you're encouraging her to take a bottle of milk with her when she leaves, she can have it later on when she can have it later on. And we'll talk about what they do with the milk when they take it home, I think on the next slide. But at this time, religious counseling may be beneficial to the mother. Social work may need to follow up. Professional counseling for emotional support, postpartum depression may be necessary, or just joining a bereavement group. So memories with the breast milk. A lot of families create an activity using the breast milk. They keep some of the milk as a memento. Um, I am aware of one mommy who kept her one frozen bottle of breast milk in the back of the freezer, and every time she went to the freezer, she would be reminded of her baby, and that was comforting to her. Um, right now, it's popular to have breast milk jewelry made. Um, A lot of families like to bury a container of the breast milk with the baby, or they conduct a ritual during the funeral service with the breast milk. Right now, it's very popular to plant trees in a memory of your lost family member. Um, and a lot of times they use the breast milk to nourish the tree. So these are all things that mothers do after they leave the hospital. So that's why we want to encourage them to take their milk with them. A lot of times they don't take their milk, they don't remember their milk is there, or even if they're encouraged to take it, they just say no at the time. So there may be a stored supply of breast milk. In our hospital, we have a milk lab, which is where the milk is stored. So they have a freezer that they would be storing the mother's milk in. And then as the lactation consultant, I typically call them. We should follow up with the mother for like the first couple weeks. Um, Usually wait for a week to make the call, somewhere in the first week, closer to the end of the first week. And then if assess their needs, if they need a follow-up phone call, like again in the second week. A lot of times they just need that to talk to someone about. So it is some emotional counseling as well. If they have milk in the milk lab, we do discuss donation with her. We do call her and ask her if she would like the milk back, if she would like us to dispose of it, or donate it. So donation may help the family with the grieving process. However, most mothers emotionally find pumping after the infant's death very upsetting. There isn't a lot of mothers that do continue to pump to donate, but some do. And when they donate, it does help them with the grieving process. They're donating in the honor of their little one's memories. So that helps them with the healing process as well. Comfort is provided in knowing that other babies will benefit in receiving this gift. That brings meaning to their child's life. Donation may provide the parents with closure. So we are at Lee Health, we are a milk depot, which means the mothers can drop off their milk to us and the milk bank comes to pick it up. Our milk bank is in Orlando and they do come and pick up any milk that we have for donation. So the milk lab is in the NICU, and that's where the milk is stored until we figure out what the mother would like to do with it. If she wants to donate it, we bring it to our lactation office where we have the freezer and the milk bank comes to pick it up. This is information from the milk bank of how much milk has been donated by mothers who had a fetal demise, which that's pretty impressive since mothers really, most of them do not like to continue pumping. The website at the top is a mother talking about how donation actually helped her with her grieving process. So I suggest taking a peek at that. So the milk bank does have certain requirements for mothers who want to donate. They do call the mother for interview. They do have her fill out a questionnaire. She must consent to blood drawing and having them take their milk. We do have a lot of mothers who are overproducers, so they do donate a lot. We have frequent donators in our area. The mothers do have to get labs drawn, and the labs, there's certain things that they're looking for that would qualify the mother. The milk bank, they contact the milk bank. The milk bank gives them all the information and pays for the labs. So basically, the mother only has to get a consent to get the labs drawn. That's the only thing she has to do on her part, especially if she already has the frozen milk. Get the labs drawn, she's cleared, she gets a donor number, they come pick up the milk. If the milk's already in the hospital, the mother doesn't have to come in. So for our mothers that were oversuppliers, they actually have two choices. They can bring the milk to the hospital. We actually go down and pick it up from them. They pull up in front of the hospital. We pick it up from them. They don't even have to come in. We bring it upstairs. We put it in our freezer. The milk bank picks it up. If it's in the milk lab, we go retrieve it from the milk lab. If the mother consents to donating, she has her labs drawn, and that's the only thing that she has to do. If they prefer to send it from home, the milk bank will also give them shipping containers with dry ice so they can just ship it directly from their home if that's more convenient for them. They will not take, the mother does have to be a non-smoker, so they will not take milk from mothers that smoke, are on metformin or blood pressure medications, antibiotics, or the milk has to be frozen for less than 8 months in order to be used as to donate back to the NICU. So in order for that breast milk to be used as donor milk in the hospital, these are the requirements. However, the milk bank will still take this milk because they will use it to calibrate their machines or test the equipment, and university hospitals will do research on the milk as well. So if the mother wants to donate and she doesn't qualify to actually donate it to a baby, she can still donate it to the bank, the milk bank, and they will still use it. So what happens is the milk bank comes and picks it up, they process it. It's double pasteurized. And it's tested before it's sent out. And then it comes back to our milk lab where it's distributed to the NICU babies. That's the process of milk donation. So I did talk a little bit about follow-up before. So a lactation consultant should be included in the bereavement care, and we should follow up for at least 14 days. The handout that was included in the article that I wrote is also similar to the handout that we use in the hospital. So everything that we're talking about, I kind of summed it up and put it into a handout, and it is given to the mothers with their bereavement package. So we do have like a little box where we give them footprints and any other memorabilia that they may want to take with them. So this handout is included in the take-home items that they leave the NICU with. Lactation, bereavement, moms groups, donation resources are all provided. So the handout, the next four pages, I believe, are basically what's on the handout. So I kind of summed it up, and it's a lot of things we already talked about, but this is for the mothers. Suppression of breast milk supply, the suppression strategies, the pump weaning strategies. The comfort measures. Self-observation. So in the self-observation, we're talking about the massaging the breast so she can feel if there's any lumps, milk trapping, anything that needs attention to prevent mastitis, the breast infection, and when to contact her provider. Any signs and symptoms that mimic flu-like signs and symptoms could be mastitis. And then we talk a little bit to her about the other considerations, the ovulating, birth controls, the quantity of the stored milk that she may have in the NICU, donation as an option, and contacting her a lactation consultant. If they're in the NICU, they've all been seen at least once when they started pumping for pump instructions in the very beginning. So they do have contact with a lactation consultant where we do give them our card and information so they can contact us when they're at home. So these are support resources that the International Lactation Consultant Association. You can find a lactation consultant in your area there. Loss and Grief Support, Postpartum Support International, Infant Loss Organizations, Mommies Enduring Neonatal Death, resources for bereaved NICU parents, which is in Spanish as well. And if to locate a milk depot to donate, the Human Milk Bank Association of North America would be in the United States. And then I have a list of the milk banks around the world on the next page. So internationally is an international website. Europe, France, Hungary, Italy, Iceland, New Zealand, Spain, and UK all have their own websites. And then these are the references used for this webinar. And thank you for coming. I hope this provided you with a little bit of information that could help your mothers that you come in contact with. Thank you.